at the front and just work backwards. Oh, you scratched yourself a little bit there, haven't you, Trouble?
Well, that might be the other cat, Bear.
Okay, do they get into scraps?
Yeah.
Okay.
Bear's not nice with him.
Oh.
Bear's only a junior cat.
Okay. So he does need to have his teeth looked at some point, alright? It's a separate issue to today, but if you can see all the tartar and things at the back.
Okay.
And the other issue is there, he's got a very red bit there where there's a tooth missing. So I'm worried that either has that snapped off or has he had a cavity there.
I don't know.
Yeah, so at some point when he's settled, do you want to take a picture? Sorry, did you want to?
Yeah. Oh, I didn't know that.
Okay.
I didn't know that.
No, they don't tell you.
I don't usually do that with him.
No, well, most cats are very good at hiding signs of dental disease, so it's not unusual not to. Right, so his glands are all okay. We know he's a lovely colour and he's not dehydrated. Let's have a listen to his heart and his lungs. Good boy. Let's have a little listen.
Good boy, Magic. Be a good boy. Be good.
Good chat, the heart sounds okay. Let's listen to his breathing. Giving a little purr, aren't you? That's what I can hear. Okay, alright.
I don't know.
Let's have a feel of his tummy then and see what
You
that
seem
bladder
to be
feels like.
thorough with checking his gums, and the other vet didn't seem to check or notice that last time.
Okay.
Oh, I know.
So he has got quite a big bladder.
He has.
Okay, yeah.
He didn't have one last time. Well, that was
No,
a
so he
few
has-
weeks back.
So he's got a bladder that sort of size, okay? So it's really full. Oh, baby boy.
What brings it on, do you think?
Stress.
With the
is a
other
big
cat?
thing. Yeah, so potentially, yeah, definitely, that's definitely can be a trigger. We tend to find that neutered males, males that are overweight as well, indoor cats are all more prone. So unfortunately, he fills a few of those categories because he is quite plump. We can't do anything about the fact he's a neutered male. He's indoors, which sometimes can just mean that they're just a little bit less active. So I'm just going to look at his willy and just check that that's okay. Good boy, I know. It's a bit sensitive.
Hold on, Madge. Hold on.
There. Let's do his temperature and see what that tells us. But ultimately, this is a problem that I'm worried that he is actually blocked. Now, we know the urethra, that's the tube from the bladder to the tip of his willy, is very long and very narrow and very wiggly in a male cat. And it quite easily, unfortunately, can get blocked, and it can get blocked with a little blood clot or a sort of little bit of inflammatory, rot, sometimes with crystals or little bladder stones as well.
Yes.
Even inflammation, sometimes it can go into spasm and shut off and close. And what we need to do ideally is to get some strong pain relief into him and something to relax him to start with. But ultimately he's going to need to be asleep and we're going to need to try and unblock him.
Yeah,
right?
I know.
So it's sometimes when they're asleep and they're relaxed, sometimes you're able just to express the bladder just by gently squeezing it and actually get urine out. And a lot of it is to do with the pain and spasm along the urethra that kind of causes it to close. So sometimes they're not, it's not a physical obstruction, it's more of a functional blockage. Now, ideally what we'll be doing is placing a catheter up his willy into his bladder so that we can drain all that urine. We can then test the urine and check that there's nothing abnormal in it, like no crystals that could be a trigger, that there's no bacterial infection that could also be the problem. Sometimes we will leave the catheter in place. So leaving the catheter in place means that we can keep that bladder draining properly, and obviously it can't reblock while there's a catheter there. The trouble with having a catheter there is that it can cause inflammation because it's not comfortable having one. So sometimes it's a bit of a tie-off between, if they're very easy to catheterise and you can pass it very easily and quickly and drain the bladder, and there's not, the urine is not really sandy or full of rot, actually sometimes just flushing the bladder and removing it is the best thing to do. It's less causes less trauma than leaving it in. But sometimes we need to leave it in, and leaving it in, we'll often leave it in for sort of 24, 48 hours, but leaving it in can cause problems as well. The trouble is, at any point when we've got a blocked cat, when we remove the cat, you know, we can unblock him, but he could block again and within a couple of hours, he could block again within a day, he could block again within, days, months. It's an ongoing problem. So we need to work out what the underlying trigger is and get him over this sort of current period. So he's going to need to stay with me now. So he will need to stay with me now for us to try and sort this out for him. And then I will be giving you a call in a few hours to let you know where we're up to and we can make a plan from there. Okay?
Okay.
Now, just get a consent form and I'll try and give you a bit of an idea about cost as well.
Marjorie. Oh.
Cost can be a bit variable because it does depend on how much needs to be done. Okay, because obviously if he needs to have a catheter in and if he's really difficult to unblock and he needs to have that catheter in and he needs to stay with us for 3 or 4 days, that's going to be quite different to a situation where we can catheterise him easily, quickly, and there's a potential if we will probably keep him overnight, and if he's urinating more, he may be able to go home tomorrow. Is he insured at all?
No.
Okay, let me give you an idea about cost then. Okay. Because this can unfortunately be an expensive problem. Okay, so we need to talk about that and just make sure, and if obviously if things are difficult, then we need to discuss that. I don't want to do something that's going to